Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai, psychiatrist, internist, and addiction medicine specialist. Today's Kevin MD article is Unregulated Botanical Products, the Hidden Risks of Convenience Store Supplements. Muhammad, welcome back to the show.
Thank you very much for having me to talk about this timely topic, the unregulated botanical products. As a psychiatrist and internist and somebody who deals with addiction medicine, I deal with these products on a daily basis, and I feel it's very, very important to talk to the public about these products and kind of the hidden dangers and how we can alert the public and alert our patients about the dangers of some of these products.
All right, so tell us more. What products are we exactly talking about?
So we have seen an explosion of botanical products that are available in convenience stores, gas stations, vape shops, and these are come in a variety of formulations. You see these sleek bottles that are energy bottles. You see gummies, you see shots, you see pills, you see powders, and these are all products that are marketed to adolescents, adults, as something that would give them more energy. And basically, you see a convenience store clerk who is acting as an advisor for unknown botanical natural products. And sometimes we see patients trusting that convenience store or vape shop store clerk more than their physicians about these products that they use on a regular basis, and sometimes with catastrophic consequences.
It's funny you say that. Sometimes when I try suggesting a prescription medication to patients, right, they would rather not take the prescription medicine, but they will take something over the counter or something they find at a grocery store. And just because it says it's natural doesn't mean it's safe, right?
Yes, yeah. And that talks of at I'm a psychiatrist, and Americans have two competing beliefs at once. They fear addiction. They don't want to be addicted to something, but they also romanticize kind of the next shiny alternative things. And they distrust institutions. They distrust us as physicians, but they also would trust the stranger who's a behind a counter who kind of speaks with a confidence, with like a cocky confidence, and people will listen to that. They will doubt our prescriptions, but they will believe a shiny bottle that they drink, 5 hour energy, 5 hour this, concentration, help pain. And these are things that have zero clinical trials, but then they people do trust them. The American Psychiatric Association actually conducted a national poll that showed that only 19% of Americans even recognize a widely sold botanical product called kratom. So only 1 out of 5 even recognize what that product is, and less than 8% of adults really felt any familiarity with other substances that are being sold in vape shops or convenience stores. So basically, there's no knowledge whatsoever. So I think that is very important for us physicians to educate our patients not to engage in these products because they carry significant adverse effects.
So in these energy shots that you find in convenience stores, I've always thought that it was just caffeine. But if you look at the ingredients, there is more than just caffeine in them. So what exactly are in these shots that you find in convenience stores?
So there's a variety of products. Some of them they call it kava, but we are finding out that a lot of these products have either kratom, we've talked about kratom in the past, metragedine, or 7-hydroxymetragedine, 7-OH. And I find it also hard to believe, but there are some data that even my colleagues who are physicians, who are actually engaged in treatment of individuals with pain conditions, who are pain management physicians, actually permit their patients to utilize kratom products with opiates. So I have seen several patients who are on opiate products, and because of lack of knowledge or lack of understanding, their pain management doctors allowed them to transition or supplement with kratom or 7-OH, which created a significantly dangerous situation because we have now two medications that are affecting the opiate receptors. And basically, what ends up happening is these people develop dependence on opiate products, and it's very, very hard for us to get them off these opioid products, and they require maintenance with buprenorphine, for example, for a long period of time for us to be able to get them off the kratom and the 7-OH.
So you're saying that sometimes with these energy shots that you can get in a drugstore or the convenience store, they have kratom and kratom-based derivatives that are habit forming. So conceivably, these patients can take a daily energy shot and find it difficult to stop that habit.
Absolutely, absolutely. I mean, so it's not just drinks. It comes in powders, it comes in pills, it comes in leaves, and sometimes people just utilize it as teas and as pills and as products that they don't understand what is it doing to them. And we are seeing a significant increase in the number of people who are calling poison control, who are basically struggling with these medications, and that I see as someone who treats individuals with addiction. And basically, we have to treat them in an addiction unit to be able to wean them off these medications.
And what kind of regulations are there surrounding these type of supplements? How do we know what's inside these energy shots, for instance, are safe?
We do not know what's inside these products. That is the problem. We have a lot of companies that are marketing these products that are making significant amount of money from these products, and we don't know what's in them. Some of them will say kratom, some of them will say 7-OH. Now we know that there are many states up till now is around 10 states now that have banned 7-OH, and that also is a difficult situation because people kratom and 7-OH with a similar product, which is cannabis, which also has a hybrid place. It is approved in many, many states for adult use, recreational use, medicinal use, but continues to be on a Schedule 1 basis for the federal government and for the Drug Enforcement Agency and the FDA. Now, the White House, to its credit, has talked about a path to move marijuana from Schedule 1 towards Schedule 3, but that has not happened. So the general public is really confused. They see these products in gas stations, they're unregulated, they utilize them, they're labeled safe, they're labeled giving energy, and then they become hooked on it. And not everybody becomes dependent on it. And I think that there may be some genetic predisposition that makes people actually susceptible to becoming dependent on it. So not everybody becomes dependent on it, but I think that we need to be careful and talk to our colleagues about counseling patients on these unregulated botanical products that they use on a regular basis.
Are any of them safe? I think that in the exam room, when I'm talking to patients about smoking and use of illicit drugs, is there anything over the counter botanical products that you feel comfortable recommending, or if a patient tells you they're taking that you feel comfortable with, or are you under one blanket? We just don't know.
I'm under one blanket. I mean, I don't know what's in them. That's the problem is when you just take that shiny bottle or shiny pill box or shiny leaves or you don't know what's in them. That's the problem. And companies would tell you, well, we have third party testers and we know this is going to be safe for you. And we don't know. They're unregulated. The FDA has chosen not to regulate them. So I think that we need to alert our patients not to utilize anything. And but our patients they seek help and they want to use things that can help them with energy, concentration, sleep, and that's why they end up with these products.
And to be clear, other than a cup of coffee, there really isn't anything over the counter or supplement based that could help with things like fatigue and concentration. There is no unicorn supplement that's out there.
There is no unicorn supplement, and this is a wake-up call to us physicians and to our colleagues that we really need an updated operating model. We want to start asking our patients whether they're taking any over-the-counter unregulated products and to document them and screen for their use. And you'd be surprised. The thought is around 30 to 40% of our patients are using some over-the-counter unregulated product on a regular basis, whether it's vitamins, supplements, some of these products. And if we're not asking about them, we're missing them.
Mm.
And I can tell you so many times that we see that a lot of our patients are taking things that are not listed on their medications with significant drug-drug interactions.
We're Dr. Muhamad Aly Rifai, psychiatrist, internist, and addiction medicine specialist. Today's Kevin MD article is Unregulated Botanical Products, the Hidden Risks of Convenience Store Supplements. Muhammad, as always, let's end with take-home messages that you want to leave with the Kevin MD audience.
I wrote this piece because I want a different future. I want a culture where our patients understand that there are over-the-counter addictive products that are engineered experiences. They're not harmful, they're not harmless lifestyle changes, they're harmful. I want also my fellow clinicians to lead with curiosity and ask their patients about their utilization of over-the-counter products, botanical products. Every patient who brings a bottle to a visit should do that without fear and talk to their physician about it and show it to their physician and have a discussion because I think these are dangerous products and we need to alert our patients because they will cause significant addiction issues for the future.
Muhammad, thank you so much again for sharing your perspective and insight. Thanks again for coming back on the show.
My pleasure. Thank you.